morning, my name is Sebastian Saelan. So today we'll be conducting an injection of intravenous, intramuscular, and also subcutaneous. Before we start, may I have your consent? Okay, thank you, sir. So first we will conduct the intravenous one. So first I will do the six step of WHO approved hand washing. Okay, so first I will apply gloves. So let's pretend there's gloves here. So just make sure to use sterile gloves. And then, so first I will apply a tourniquet on the patient. So proximal, I will apply proximal to where I will administer the injection approximately. So make sure it's tight, but not too tight. But there's the syringe, so I will make sure. So I will use one hand, and I will remove the top using my dominant hand. Then I will aspirate the syringe. Okay. So first what we will do is we will actually take the drug that your problem would be administering. So for example, this would be the drug. Just there, right? Drug. Let's assume you have the right amount already. And then I will take alcohol swab, and let's say I'm going for the vein right here. The median cubital vein would be the most commonly used and the most easiest one. So just apply the alcohol swab. Make sure it's inside to outside. Okay, and this. And then wait, just pause it. Wait. So after I will administer the alcohol swab, so make sure it's from the inside to outside in a circular motion. Okay. And I will make sure that the needle is facing upwards, so the hole will be facing upwards, not downwards. And now I will inject it into the vein. Excuse me, sir, this may be slightly painful. And once you hit a vein, perform aspiration. And then if there's no blood seeping out, and then you should be good to go. So I will, and then after the injection, you can release the tourniquet, and then you administer the medicine slowly. And then after when medicine is administered, take it out, and then apply pressure to the punctured spot. And the syringe, you will dispose it in medical bin. So there you go. And then you apply the wound for 2 to 5 minutes, or you can ask the patient to apply too if you want to do that. And after 12 minutes, you can let go. The bleeding should have stopped by then. And now remove the gloves and then throw it in the trash bin, and then do 6-step hand washing again. And intravenous injection is done. Okay, cut. So now for intramuscular injection, so we will be conducted around the deltoid region. So let's assume the medication is already in the syringe, and then so what you will do is do it 90 degrees. So like this, 90 degrees, and then you insert it. And then you perform aspiration to make sure you don't hit a blood vessel. And if there's no blood, then you can go through with it. So you inject the medicine slowly. and then take it out, and then you apply pressure on the region for a few minutes, and then afterwards it's done. You see the area, if there's any, if there's any bleeding, any redness, any itchiness, ask the patient. And then for the syringe, you throw it to the sterile bin, and then you wash your hands again. Okay, so next up is we will conduct cutaneous. So let's assume the medicine's already in the syringe. So first what we'll do is we would use an alcohol swab on the area that we will inject. So let's see around here for now. So, and then remove it. And what we'll do is, using your hand with the glove, you will pinch the area. So pinch it kind of hard like this. And since the needle is very small, we can do it 90 degrees. So just insert it immediately. And then do aspiration to make sure no blood is seeping out. And then just inject it. Inject it slowly. 1 milliliter, 10 seconds approximately. Okay, and then pull it out, and once you're done, use the alcohol swab to apply pressure on it for 2 to 5 minutes, and then you will remove the alcohol swab after that. Make sure there's no redness, no bleeding, no itchiness on the punctured side. You throw away the needle to a sterile bin, and then you do the 6-step hand washing. Okay, so next up is the intradermal. So for intradermal, we use the small needle. So first what you do is, again, use an alcohol swab on the area you want to puncture. So let's say around here again. So do from turn the inside to outside in a circular motion, and after that you will want to inject the needle. Make sure it's the hole is facing upwards. You want to inject the needle at around very 10 to 15 degrees, so around that much. And do aspiration, make sure you don't hit the blood vessel. And then what you want to do is, and then you inject the medicine into the patient. As you slowly release the syringe. Okay, and then you will apply the pressure with the alcohol swab back on the puncture site for around 2 to 5 minutes, and afterwards you will throw the syringe and then wait 10-25 minutes, and analyze if there's any redness, any swelling, or any itchiness on the punctured area. And if there's none of that, then you're good to go. And then obviously after you dispose the syringe, remove your gloves and do 6-step hand washing. Done.